So we're going to talk about something very fun. We're going to talk about the SI joint.
What's the SI joint?
Well, I'm glad you asked. I just happened to
She's
carrying around my pelvis.
you know.
So this is your pelvis, okay? This is the bottom of your spine. This is your pelvis. These are your femurs, your leg bones. But your SI joint is where the sacrum, which is this bone right here, meets the ilium. All right. And it was thought that there was no movement here, that this fused. And it does fuse in some people but after the age of 40, but it doesn't fuse in a lot of people. And because of that, there is movement there. Okay. And that movement can cause some real pain. It's a very innervated area with lots of nerves, and it can cause pain. And it can even cause pain that runs down the legs. So that's your SI joint. And where that would be on you would be turn on around, right there. If you say, where do you have pain? Go ahead. And they go right there. And they'll point to that spot. All right. You have one on each side. Mm-hmm. And if you put your fingers there and press and it hurts, you might have some SI instability. And it's something that could come and go. Like I do have SI instability. Right now, I don't. Okay, when I press on there, it feels pretty good. But some days I'll press and it'll be like, oh, all right. So what do you do if you have that? And Don Tigney did a study back in the early 2000s, Richard Don Tigney, and he looked at 1,000 people and found that about 98% had some kind of SI problem. And he has a very special technique, and he used it. And the vast majority, almost like 80, 90%, when he used the technique, got better. And it's a very, very simple technique. So we're going to show you a general technique that you can try, that you need somebody else. All right. I mean, I guess you can do it without, but it's better with somebody. And then we're going to show you his self-correction that you can totally do by yourself. Now, it's a great correction. The problem is, number one, if you've been out for a while, you may have to do it every hour. All right. Once it starts to stay in, you can slowly decrease it to 5 times a day, then 3 times a day, then once a day, then not at all until it goes out again. And then you might have to do it off.
By going out, you mean their SI joint.
Your SI joint goes out
again.
It moves. Okay. You feel that pain.
You feel that pain in there.
Yeah.
Yeah.
And so it's really important that, doing it once probably won't fix it. I mean, it might fix it for a few minutes, but if you've been out for a while, everything's out of alignment. So you might have to keep putting it back into alignment until it stays. Mm-hmm. The other thing is, Dana's going to go over this, there's some muscles that have to be fixed so it doesn't pull out. So I'm going to let her go over that. But first, let's show you the self-correction, the shotgun and the self-correction, and then Dana will go over the exercise.
And can I add real quick, I always describe the SI joint and the sacrum as kind of the keystone of your body. There's so much attachment from muscles around this area. And so the SI joint is under stress a lot. So even if you have maybe an injury or like you rolled your ankle or something in a different part of your body that kind of throws you off a little the way you're moving, sometimes the SI joint, even if you never had SI joint pain before, it can become unstable and you can get a little bit of that shifting there. So even if you've never had pain before and you maybe had an injury somewhere else, it's not uncommon to have to go and treat your SI joint as a secondary, reason, like a secondary cause.
Definitely. All right, so jump up on the table. Let me go around. All right. So here's the shotgun. What that does, let me grab the pelvis so they can see why this works. So what the shotgun is we're going to use your adductor muscles, the muscles right on the inside of your thigh, and they connect right here. And what they do is when you contract them, they can help pull the SI joint back in place by using these muscles on the front of your pelvis. All right. So let's have Dana bend her knees up. And what she's going to do is she's going to push her legs apart against me. All right. And I can do that once, or I can do it 3 times. Okay. But at least once, real hard. And she's really resisting. Then I have her push her legs together real hard. Good job. Okay. Now she was out. I'm going to hear that confirming pop, which I love. So push again.
If you do this and you get a pop in there.
And don't be afraid. Sometimes they're really loud.
Yes.
All right. What we're hoping is that her pelvis will go back. Now, a therapist will check your pelvis here or at your ankles. We're we're just going to show you the technique, okay? Don't worry about that. All right, so what she's going to do, she's going to bend this leg up, put that one straight, and then it's sort of like a one-legged bridge. So she's going to lift her hip up, and what she's trying to do is get her knee over her foot and then back down. And she's going to do that 3 times. And try to get your heel as close as you can. Beautiful. Good flexibility. All right, and then she's going to switch and do the other side. And the reason you do both is, Don Tigny's whole theory is, if it's out, it'll go back, and if it's stable and in place, it's not going to do anything. So you do the other side, all right? So that you as a non-therapist don't have to figure that out. So you do 3 times on each. So this is her second set of 3, all right? Then she's going to do it on the other side, right? And then she'll do 3 more, okay? And that's it. All right. And then you might want to do some pelvic tilts and stabilization and the exercises that Dana's going to show you.
Yeah. So often with a SI issues, or even sometimes back pain in general, commonly, and this has been shown in literature over and over, that hamstring tightness, the hamstring is the muscle back here. If you're a little short or tight in that, it can put added strain on the SI joint or your low back. So you can stretch your hamstring. You can put one leg out. You can even just hold with your hands behind your leg and straighten your leg. And you will, if you get a stretch back here, you know you're getting benefits from the stretch. Hold 30 to 60 seconds 3 times on each leg. If you want a little bit of overpressure, you can use a towel, a yoga strap, whatever you have, hook it around your foot, and you can pull up this way for a little more passive stretch. There's many ways to stretch your hamstring. I like doing it lying down so your back is supported, and you would obviously do this on both sides. Then the other component is strengthening your glutes. So our glutes, our big butt muscles, are often weak if you have some SI joint instability. So a very easy way to strengthen them and very effective are some bridges. So with your knees bent, I'm driving my heels into the table and squeezing my butt muscles. I'm going to lift my hips up and lower down. Just a quick pause at the top and lower right back down. And bridges are very easy to progress and make more challenging. So you can take a looped band and put it around your knees. And as you lift up, at the top of the bridge, you can pull out against the resistance, and that pulls in some of the lateral glutes, or your gluteus medius, as well as the glutes on the back, your glute max. So that's a progression. And a more challenging progression is a single leg bridge. So I like to bring one leg up to like a 90-degree angle here. And then key is to lift your pelvis so it doesn't tilt to the side as you raise your legs. So as you raise your hips. So I'm going to lift my hips up, keeping my pelvis stable, and back down. And that's much harder. Now, if that puts any strain on your back or through the SI joint, you're not ready to do it yet. So go back to one of the other options for the exercises. Any comments on those?
I think that looked great. That's very, very good. If you don't want to do all that many, I always say 8. If you fatigue at 8, that's great. If fatigue at 8, that's so many rhymes. Yeah. But you could use a really strong rubber band, really strong. And by the time you get to number 8, you're barely lifting your buttocks. If that gets easy, then you do the one leg. All right. Yep. I think those are great. Thank you from the bottom of our hearts for listening to this episode.
For the most up-to-date information about our videos and our products, please visit our website at exerciseforagingwell.com.
And be sure to subscribe, give us a thumbs up, and tell your patients, your friends, your neighbors, your parents, your dog to listen and to do anything to spread the word.
Together, we can create a healthier, more pain-free, and active future. Thank you again, and stay healthy.
Thank you.